Confused about the increased risk of suicidality in patients taking antidepressants? Hi, it's Brain Bites with me, Dr. B. I'm Jess Beachkofsky, your friendly online psychiatrist, and in this video, I'll be talking about the risk of increased suicidal thoughts with a case example of someone starting an SSRI. Let's dig in. The major risk people worry about is the black box warning for SSRIs and SNRIs that lists an increased risk in suicidality in people under 24 years old. This is a risk that was noted during large trials of these medications decades ago that found some people initially started on antidepressants would sometimes feel suicidal. This is a known risk of antidepressants that we're not sure where it's coming from. In general, as long as patients are aware of the risks, it is almost always preferable to treat the depression, which in itself is a strong predictor for suicidal thoughts and actions, than to avoid them because of this potential risk. But it's important to monitor for clinical worsening, suicidality, and unusual changes in behavior, especially during the initial few months of treatment or following dose changes. This is a case of increased suicidality after starting an SSRI. Alex is a 22-year-old male and is a recent college graduate who majored in computer science. He's been working as a junior software developer at a tech startup for the past 6 months. Alex has always been a high achiever, but the transition from college to full-time work has been harder than he expected. Alex grew up in a supportive family, but has always been prone to anxiety and perfectionism. In college, he managed his stress through exercise and socializing with friends. But since starting his new job, he's been working long hours and has less time for the gym and hanging out. About 2 months ago, Alex began experiencing symptoms of depression. He felt constantly tired, lost interest in his hobbies, and started isolating himself from friends. His work performance began to suffer, which increased his anxiety and feelings of guilt and worthlessness. Concerned about these changes, Alex visited his primary care doc, who diagnosed him with depression and prescribed Paxil, or paroxetine. Alex was initially hopeful that the medication would help him feel better, so he could get back to feeling like himself again. 10 days after starting Paxil, Alex noticed a new upsetting concern. While his energy levels had improved slightly, he was now having intrusive thoughts about death and suicide. These thoughts scared him because he had never even thought of suicide before. The suicidal thoughts usually happened in the evenings when Alex was alone in his apartment. He found himself imagining ways to kill himself, though he hadn't made any concrete plans. These thoughts were accompanied by feelings of guilt and shame, as he felt he had no reason to be so unhappy given his supportive family and new career. Freaked out by these new symptoms, Alex decided to go back to his doctor to find out whether the medication could be causing these thoughts, or if it was his depression worsening. He was unsure whether to continue taking Paxil. The decision to keep, stop, or switch medications should be made jointly between the patient and the prescriber, considering the following factors. The severity of suicidal ideation. If the thoughts are severe or accompanied by a plan, immediate action may be necessary, including possible medication discontinuation under medical supervision. The timing of symptom onset. If the suicidal thoughts emerge shortly after starting Paxil or increasing the dose, it may be more likely related to the medication. The overall response to treatment. If the patient is experiencing some improvement in depressive symptoms, continuing the medication with close monitoring might be appropriate. Patient preference. The patient's comfort level and willingness to continue the medication should be taken into account. Alternative treatment options. Consider whether switching to a different antidepressant or adding psychotherapy might be beneficial. Risk-benefit assessment. Weigh the potential risks of continuing the medication against the risks of untreated depression. Now, although you're not the prescriber here, knowing the steps we take next is important for guiding Alex towards the best outcome, after he calls his doctor, of course. After explaining the situation to his doctor and discussing options, the medication was switched to a different SSRI, Lexapro or escitalopram, with very close monitoring via phone calls with his doctor. A week after the switch, Alex's suicidal thoughts had nearly disappeared, and his depressive symptoms continued to slowly improve. He has not had any recurrence of suicidal ideation. I hope your brain is full of serotonin goodness. Not too much and not too little, but just right. Be sure to enjoy more tasty tidbits at brainbiteswithdrb.com. Enjoy!